Welcome back to our third video in this series. My name is John Williamson. I'm the clinical lead and trainer for Atlantis Medical Limited. So I would normally do this in a practical live session. So you'd usually be with me in a workshop when I take you through this. But because of the public health issue we are all currently observing, we want to make the best of it and come to you with video. So I hope you're relaxed enough, but also paying attention. So we were talking about the mnemonics for a first aider. Now don't forget that first aider is got three aims, and that is to preserve life, to prevent condition from deteriorating, and also to aid gradual recovery. Now you have very limited time to do all of this, because at this stage you're very close to the casualty, or close enough to observe for their airway. So we are on the A, which is airway. To follow this sequence, you would have watched the first two videos. Now, how do we observe for a casualty's airway? And what are we looking for? Because this casualty is not responsive. And if a casualty is not responsive, it's something that is neurological. But don't forget that the neurological, which is the brain, controls and coordinates all the other communicates with all the rest of the body via the central nervous system. So if the casualty has got a neurological deficit, if they are unresponsive, then it's very possible that their breathing could be affected. Now, the reason why we're so concerned and we want to start with the airway is, I was asking in the previous video, well, I didn't ask in the previous video, but what I want to ask you now is, how long do you think it takes for a casualty who has stopped breathing to have a respiratory arrest? That is, their respiratory function stops, it arrests, or they die. So how long do you think that is? I hope you said something you thought along the lines of 3 to 4 minutes, because if you did, that is accurate. So within 3 to 4 minutes of a casualty not breathing, they would go into what we call a respiratory arrest. And for that, it means that there isn't going to be gas exchange, which is oxygen going to the bloodstream, pumped into the circulatory system, to the brain and the vital organs, and the waste gases, carbon dioxide, being eliminated via the gas exchange between the cardiac system and then the respiratory system, the pulmonary, cardiopulmonary exchange, and then through the process of expelling air, expiration, the air comes out in the form of carbon dioxide. So you're taking in oxygen and you're expelling carbon dioxide. But that process would be stopped within 3 to 4 minutes if you're not breathing. So we don't know how long this person has been in an unresponsive state, but we know we don't have a lot of time. So what we do is, we will have to make sure that the airway is not obstructed. We have to make sure that the airway is not obstructed, meaning there's nothing blocking the airway. Now, one of the first things that we have to do is we put the index finger, the middle finger, at the tip of the chin. Now place your hand on the forehead and just tilt that. You can have a good look that way. Now with this process, you also allow the tongue, which, because the rest of the body is unresponsive, the tongue collapses and blocks the airway. So when you do this, you would allow the tongue to move back in position. A good demonstration of this is if you take just a couple of minutes or maybe a few seconds under a minute, put your chin down this way and try to take a deep breath. Imagine how that feels. Now that will give you some idea of how it feels for the unconscious, unresponsive patient to try to maintain their airway. It's next to impossible. It becomes more and more impossible. So by this time they are not breathing, they cannot maintain the airway. It's blocked and they don't have a lot of energy to sort of move the tongue out of the way. And so that's what you do for them by putting the index of your finger, your middle finger in a duet at the tip of the chin with your hand or the forehead and just tilt it. So you tilt it and it arcs up. Now the other way you can understand how this impacts on the casualty is if you lift your head up, full up, and try to take lungs full of air. It's a lot better. So that's what you facilitate. You facilitate an open airway when you do that. Now, provided the airway is open, there's no reason they should not be breathing unless there are other complications, other medical factors. So when you've done this, you are also looking at the movement of the chest movement. Oh, by the way, let me just retrace my steps a bit. When you've done this, you are observing for any obvious obstruction to the airway. And we'll come to the other obstructions. So the tongue is out of the way. Are there any solid obstructions? Are there any liquids that, like vomit, being sick, that could aspirate? Okay. Now, if the person is being obstructed, hence affecting their breathing, or if they are obstructed. Now, if you're in a medical setting, we have what we call a suction. So the person is tilted sideways, and sometimes you may not even have to wait to do that before you start the suctioning process, but we won't go into that. We're talking about basic life support. Now, a good position is to turn them on what we call a recovery position to allow gravity to tilt them so that instead of it going backwards into their lungs, it's actually, if it's a liquid, it's actually oozing out. Now, if it's a solid object, obviously, if it's something here, provided your fingers are protected, you want to take that out, but not by putting your finger inside the mouth, which you must never do for health and safety reasons, for your own safety as well, for the casualty, because you run a risk of pushing that further. But you are trying to make sure that there is no blockage. But the point I'm making is, let me retrace my steps here. When you unobstruct the airway by doing a chin tilt, chin lift, you are looking downwards over the chest, movement of the chest. And you are listening for the sound of respiration. And you should also be feeling it on the side of your cheek. We call that look, listen, and feel. Look, movement of the chest, listen, and feel. And you should just use 10 seconds. Now, within those 10 seconds, if you cannot see this casualty breathing, then you know that you need to move on to the C, which is circulation, which I will go into more detail about in the next video.